Hello ladies and gentlemen, today's video will be about ECG, specifically made for medical students. So if you are not a med student, I don't think this video will be of interest for you. Obviously, you can still watch it. Today's video is actually first of the many ones I'm planning to do about ECGs. So let's start what is ECG. ECG is actually a very old tool used widely even today, and it measures the electrical activity of the heart. By measuring electrical activity of the heart, we are not only able to know what is going inside the heart electrical part, but also we are able to predict and understand its mechanical activity, its contraction, how it's going, what's happening, etc. There are exceptions where we have something called electromechanical dissociation, which I'm going to talk in the future videos. But these exceptions where electrical activity is separate from mechanical activity are very rare, and I'm going to talk about it later. Now, why is ECG so much widely used even today, even though it was discovered, I think, at least 2 centuries ago? Why it is so popular? Well, actually the answer is simple. It is fast, it is cheap, it doesn't have any side effects, it's just you are attaching electrodes to the outside of the body, and it is quite effective in putting the diagnosis. Now, I want to point out, because it's the first video about ECG, that ECG itself is useless. Separate ECG doesn't give us anything. For example, this ECG can be showing myocardial infarction or nothing at all, nothing acute is happening right now. And ECG is useful when doctor has knowledge and experience and with other diagnostic tools. Only that way we can use the full power of ECG. I want you to remember that. Otherwise it is useless. Before we move to the ECG, we'll actually want you to discuss the ECG machine. ECG machine has 10 electrodes. All of them are attached to our body. 4 electrodes are attached either to the ankles and the wrists or to the hip and shoulder joints. It does not really matter. Now, before you place the electrodes, keep in mind that the electrode skin contact should be clear. Sometimes even shaving may be necessary to remove excess hair. Plus, conductive substance should be applied there, a gel or a fluid. Both of them are fine. Now keep in mind that because ECGs, vast majority of ECGs are done in hospital, don't take distilled water without electrolytes, which is a lot in the hospital for injections and other purposes, and this water will not be good. It will opposite, make the ECG worse than making it better. All the other conductive substances will be great. As I mentioned, we have 10 electrodes and 4 of them are placed on the limbs. Now, we should know the colors. Always we start ECG from right to left. Right arm attachment, left arm, left leg, right leg. So it goes kind of in a circle. And all of these 4 electrodes have colors which I would like you to remember. So first color is red, yellow, green and black. Like a black traffic light, for example, easy to remember. And for those of you who are in United States, the colors are different specifically. I don't know why. So it would be colors from right arm, left leg. Right leg would be this: white, black, green, and red. That's kind of unique, and I don't have any mnemonic. Now, the other 6 electrodes, which are placed on the chest, they also have specific colors. But because there are so many of them, they are also numbered. They can be numbered either C1 through C6 or V1 through V6. Both of them can occur. Let's start with the V1. V1 is placed in the 4th intercostal space near the sternum on the right side. V2 is placed in the 4th intercostal space again, but on the left side near the sternum. Then we place V4. V4 is placed exactly at the mid-clavicular line, at the 5th intercostal space. And after that, we place V3 between V2 and V4. V5 is placed at the anterior axillary line, and V6 is placed in the mid-axillary line. Most of the times, It's actually obviously not the doctor's but the nurse's job to place the electrodes. But first of all, as a medical student, as a resident, and as a doctor, you should always know and make sure the electrodes are placed correctly, because it's your responsibility. Maybe the nurse misplaced them by mistake. You should always check, especially when you are present when the ECG is being taken. So knowing the colors, knowing the placement of electrodes is quite important, and how to attach it. Also, patient placement is important. Patient should be lying on bed, so he or she will be relaxed. Second, you should ask the patient not to speak, not to breathe, because ECG takes several seconds. It's quite possible for the patient not to breathe. If there are some problems, let's say tremor like in Parkinson's disease, other types of tremors or other types of problems, you should always observe them, and try to minimize them as much as possible, because otherwise ECG quality will be low. Something called artifacts, which I'm going to talk about it later, will occur on ECG, and obviously this will actually make reading ECG a little bit harder, especially if you are not specialized in reading ECG in the first place. Before we will start reading ECG, let's look at the ECG paper. As you can see, ECG paper consists of squares. These squares are large squares and small squares. Each large square consists of 5 small squares, horizontally and vertically. Now, the squares are not just for looks. They are used specifically to measure something. It's like a ruler for us to measure stuff. Now, on vertical line, squares measure voltage. This voltage is very, very important. Each small square represents 0.1 millivolts, and 10 small squares or 2 big squares represent 1 millivolt of voltage. Now, why do I care about voltage? Well, first of all, let's remember something. I don't feel electricity produced from my heart. The ECG machine records electricity produced from my heart and amplifies it for me to see on paper, to see different waves, different diseases, norm, etc. So, when it is amplified, we should have a standard voltage, standard calculation. Always it is 1 millivolt or 10 small squares or 2 big squares. It should be always like this. Let me show you an example. Here we see 3 different types of ECGs, and they look different, but in reality they are the same ECG at the same time from the same person. It just, in one of them I have the normal voltage, in another I have the increased voltage, and in the third one I have decreased voltage. And this can confuse you. So make sure before you start taking ECGs that the machine is calibrated correctly, and this square is always 1 millivolt in height. Now let's talk about horizontal line. Horizontal line measures the speed of ECG. The speed of ECG means how fast is ECG recorded. Usually it is 25 millimeters per second. This is the usual speed. By knowing the speed of recording, I'm able to tell time. Basically, I can tell what every small square means. Every small square in this situation will be 0.04 seconds or 4 hundredths of a second. And each big square obviously will be 0.2 seconds. So 5 big squares mean 1 second. Knowing this information, I can calculate the heart rate of a patient. Because let me show you again 2 ECGs. One is 25 millimeters per second, another is 50 millimeters per second. They are the same ECGs, again, in same patient at the same time, done at the same time. But you can see how much different they look from one another. So, before you start doing anything, guys, always check the speed and voltage of ECG. Is it calibrated correctly or not? Next, I would like to talk about the flat line or isoelectric line. Now, this isoelectric line is recorded when there is no electrical activity. Obviously, when there is a stopping of the heart, or you can even record it when there is nothing attached to the ECG machine. This means it records voltage as 0, totally 0. Now, any voltage that goes above this flat line, isoelectric line, or below this line is called a wave. That is a definition of a wave. Now, if this goes above this wave, it is called a positive wave. If it goes below this line, it is called a negative wave. Now, negative and positive, as I'm sure you know as medical students, does not mean anything, right? For example, if they tell you your some kind of infection tests are positive, it's a bad thing, right?
Not just sure, we're HIV positive.
So in this case, positive and negative wave separately don't mean anything at all. They are just meaning either they are going above the isoelectric line or below the isoelectric line. That's it. So we know the definition of waves and we know the definition of isoelectric lines. Now that we know about waves, I would like to talk about specifically what each wave means, right? So first of all, let's look at this ECG, and we have standard waves. The small wave here, which is called the P wave, and it represents depolarization or contraction of the atria. Atria contracting and depolarizing at the same time. So it's a P wave. After that, we have a QRS complex. It is called QRS complex because usually it consists of several waves, so it's called totally a QRS wave complex. It represents depolarization and contraction of the ventricles. Obviously, ventricles are bigger, they produce more electricity, so the wave is much bigger than the P wave. Third one I would like to talk about is a T wave. T wave is repolarization or relaxation of the ventricles, generally shown here. You will ask me, where does relaxation of the atria, or where does it go? Obviously it happens, but we don't see it. We don't see it because relaxation of the atria and contraction of the ventricles occur at the same time, and both of them produce electricity. What is important here is that electrical current, which is bigger, is recorded by ECG if it occurs at the same time. My point here. So, for example, if two people were talking right now in this video, the one who would be talking louder, that voice would be obviously recorded. The other voice would not be recorded at all. This is actually what's happening because there is a little bit noise outside, but you don't hear it at all, generally. My voice overcovers it. The same happens to the electrical activity. Repolarization of the atria is overshadowed by QRS complex. Next thing I would like to talk about is called segment. Segment is actually a flat line, part of the isoelectric line we talked about, that occurs between waves. You know, there are all types of segments between all the waves, but two types of segments I would like to talk more. It is called ST segment, basically a flat part of the flat line which is located between QRS after the S wave and before the T wave starts. It's called ST segment. The second one is PR segment. Now, PR segment is a little bit incorrect name. You know, when people discovered it, they called it incorrectly. The PR segment is actually a flat line between P wave and Q wave, not R wave. When Q wave starts, this segment finishes. But generally it was misnamed, so it's called a PR segment, not a PQ segment in reality. And the third terminology I would like for the beginners to remember is something called interval. Interval is actually a combination of wave and segment. The two most important intervals I would like to talk about is QT interval, which includes QRS complex, ST segment, and T wave. It is called QT interval. And the second interval is PR interval. PR interval includes P wave, again PR segment, and that's it. Again, it should be called PQ interval because it ends before the Q wave starts, but again, it's misnaming, so don't let the name confuse you. Now, why am I focusing on these specific intervals and segments? Because the changes indicate many different diseases. They are important. And obviously, we're going to talk about it in the future videos. This concludes our first ECG lecture. If you have any questions, comments, suggestions, please don't hesitate to comment. I would love to hear from you. If you like this video, please like and subscribe. If you did not like this video, I thank you for listening this long. Goodbye.